Good morning, good afternoon, good evening, depending on wherever you are watching me from or when you come across this video. Today, I'll be discussing an important issue regarding our dental health today. And the issue, I don't want to call it a topic, I want to call it an issue because it's actually an issue, not just a topic. The the title of that issue is bleeding gums. Bleeding gums. Most people, when they brush their teeth or they do one or two things in their mouth, they notice that blood is coming out from their mouth, maybe in the gums and all that. Well, before we go on, as you are watching this video, I would like you to press the subscription button so I can subscribe to my YouTube channel. Also turn on the notification button so that anytime my video comes up, you'll be the very first person to actually know about it and follow in whatever thing we'll be teaching. Also, I would like you to like this video, share it among your friends, share it widely so that those who are having this kind of issues will know what can actually cause it and one or two things that they can do when such things come up, especially when they don't have access to the dental clinic as quickly as possible. Most times, some dental issues can come up maybe probably in the midnight or over the weekends when a lot of dental clinics are not open, that you may not have access to dental professionals for professional dental care. So at least you know one or two things to do, what we call dental first aid. At least you know what to do to ameliorate the pain or the condition pending when you get expert attention. So like I said, today we'll be looking at bleeding gums. I'll be trying to be using some terms that you can easily identify with. I will try to avoid the professional jargon so that you don't get confused or try to uh, uh, not to follow what we are saying. So I'll try to use some of these words you can identify with quickly. So, like I said, sometimes some people, or even you watching me, must have experienced it one time or another, or you are even still experiencing it. That anytime you try to brush your teeth, you notice that there is blood coming out, maybe on your toothbrushes, or when you spit out, maybe try to gargle your mouth, you have this taste of blood, or when you spit out, you see maybe blood mixed in the water you used to rinse your mouth and all that. You see, what it's showing something is just showing a sign that something is wrong with your gums. Your gums are compromised, they are infected, they are inflamed, something is wrong. Once you have this kind of feeling, don't just take it for granted. Most times, because we are usually reactive, so we tend to like believe that okay, is it not just this? Probably there's no cause for alarm until maybe something gets worse. So please, once you notice blood on your toothbrush while you brush, or you gargle your mouth and you don't have any injury in your mouth, and you spit out and there is blood mixed in that water, something is actually wrong with your gums and you need to seek for expert attention quickly, because gradually from the gums it can have affect the teeth and it could become complicated. Now a number of things can actually cause gum bleeding. Number one, there are some persons that they can never believe they have brushed their teeth well or that their teeth is clean except they have used hard toothbrushes. And we try to discourage the usage of hard toothbrushes because one of the things is that they cause injuries to the gum, especially when you don't even use them properly, because there are ways you use your toothbrush to brush. Most times the way I see people brush their teeth, I will be like, no, this is not the right way to handle your toothbrush in your mouth. Again, when people use some of these hard toothbrushes, a lot of persons think that it is the pressure they apply, when they are brushing so hard, brushing with every energy in their body, that is when their teeth is being cleaned. That is also wrong. You're actually causing a lot of damages to both your teeth tissues and even the soft tissues, including which includes also the gums. But today, because my attention is on the gums only, so I will just be talking about the effect on the gums only for today. Now, some persons also, you see them try to use some sharp objects in their teeth. You see some people using pins, using nails on their teeth. I know you will be surprised, but I make bold to tell you that there are people who do some of these harmful practices, and these things can injure the gums. And when they injure the gum is a very soft tissue in the mouth, and it's made up of so many blood vessels. So when they injure the gum tends to bleed. And when you don't take care of these gums to treat them and do what you're supposed to do to these gums, of course, infection can set in. And before you know it, the gums will be swollen, there will be pain, you'll be feeling so uncomfortable. Of course, then comes that bleeding we are talking about. So a number of things like I've just mentioned can actually cause this. But I'm limiting it to just these three I just mentioned now because they are so common. When people brush so roughly or they apply so much pressure while brushing, you end up injuring your gums. We've said it times without number that it is not the pressure you apply while brushing that cleans your teeth. Rather, it is the technique with which you brush your teeth that actually cleanses your teeth. Number two, using hard toothbrush. Hard toothbrush is not for an average person. There is always reason why a hard toothbrush will be recommended for any particular patient. So please, if hard toothbrush is not being recommended for you for a particular reason, it is not meant for you. So that you don't, because you want to clean your teeth, you'll be causing more harm to your teeth and to other soft tissues in your mouth. So please, if you are not on recommendation for hard toothbrush, it is time to drop it now. Number three, using harmful objects in your mouth, like I mentioned earlier on. Some people can use like the toothpick, the nails, pins in your teeth. These things will always injure your gums, and when they injure your gums, they will bleed. And when they bleed, infection will set in, there will be swelling, and other complications in your mouth will come in. So please, if you are a kind of person that engage in any of these three things I just mentioned now, please, it is time to stop such habits. That is number one. Now, two, make sure that once any of these things occur, you seek for expert dental attention. The thing is that maybe when we see it for the first time, we just be like, nothing is wrong now. There is nothing, it's not something, it's not a big deal. I think that's a word people normally use now. It's not a big deal. It's not a big deal until one day you just notice that the infection is growing deeper and bigger. Before you know it, you start feeling that your teeth is shaking or being mobile, a kind of, because the gums are part of the supporting structures that hold the teeth in place. So once they start having issues, they are inflamed, there is swelling, there is infection. The next thing is that the tooth, or rather the teeth that is holding, that is supporting as a structure, will also start losing its firmness. And as time goes on, can become mobile, and if time is not taken or if care is not taken, the tooth can fall off. And as an adult who already have the adult teeth, once you lose an adult tooth, you have lost it forever. So it's not like probably maybe a child who still have the milk teeth, you will say, okay, maybe when the adult teeth comes out, it can replace that. But once as an adult, once you lose your permanent tooth, it is gone and gone forever. So it's always good to pay very serious attention to your teeth. And anything that happens to your teeth has most times also comes from the gums. So that is why your attention should also be on the gums. Now, a lot of persons, when they brush their teeth, they don't know that the gums are also part of the places that we brush. And that's why I say that when you brush, it is not the pressure you apply, it is not the kind of toothpaste you use, It is not the kind of toothbrush you use that cleanses your teeth, but the kind of technique, the toothbrushing technique you apply, that is what actually determines if you have done a good job cleaning your teeth or not. And it also does not depend on if you have spent 2 hours brushing. Actually, once you brush properly, the way you are supposed to brush using the right technique, in 2 minutes you are done. And it is not when you brush maybe 50 times a day or 10 times a day. If you are doing it wrongly, you will not have good results. And that's why you see some persons, they think that maybe after brushing, they feel they are not having good breath or something, they will rush to brush again and all that. It means that something has not really been done well. So maybe in the next episode, I will teach you how to brush the right toothbrushing technique so that you don't waste your energy, putting energy where you're not supposed to put that energy. So please, these are some of the things you need to know about your gums. Your gums are very important. Once your gums are not healthy, your whole mouth, of course, will not be healthy. Because, like I said earlier on, they are the supporting structures that hold your teeth in place, or rather, they are part of the supporting structures that hold your teeth in place. So, anything that will bring injury to your gum, make sure you are not a culprit to that. Avoid anything that will bring injury to your gum, that will make your gums to bleed, including using a toothbrush you are not supposed to use. So please make sure that you avoid these things I just mentioned. And should any of these things, maybe you notice that blood coming out when you brush or when you gargle, make sure you seek expert dental attention. It's very important. But meanwhile, just in case something like this happens over the weekend, or you are in a place where you can't access an expert dental professional immediately, or at most probably within a day or two, you can just do one or two basic things to just help you pending when you have access to a professional dental person. One, just make sure that you use just salt in warm water gargle. Just use it, gargle around your mouth, gargle properly, vigorously, spit out the water. You can just gargle maybe 2-3 times a day, 2-3 times a day. It will help to be keeping your oral hygiene in check pending when you now see a dentist, because a lot of things could also be the cause. There could be maybe some deposits, what we call dental plaque, dental calculus, stains. All those things can also cause gum bleeding or making your gum to bleed. So that is why it is also good that you seek expert dental attention, so that if any of these things are the causes, those things can be professionally removed and your gums will be free again. But pending when you have access to the dental professional for this expert attention, like I said earlier on, if you are in a place where you don't have access to an expert dental professional, or maybe over the weekend when a lot of dental clinics are not open, pending when you have access, you can just use warm water, salt in warm water, and gargle. Avoid taking any medication at this point until there is an expert who have examined you, and if you have been placed on any medication, it will be based on prescription, what they have seen and assessed, and they probably diagnose that this is actually what you have. So, but make sure that you avoid self-medication at this point. So, like I said, please make sure that you turn on the notification button so that once my information comes up, you'll be the first actually to get this message. And subscribe to the channel by pressing the subscription button. Share this information widely to your friends and family, because I know that bleeding gums is one of the commonest dental issues a lot of persons have, especially in the morning when they brush, they see blood, they will tell you, they try to suck, you have a taste of blood or a feel of blood, they spit out, they gargle, they see blood mixed with the water and all that. If you avoid these things I mentioned earlier on, and even if they come and you take those steps I just enumerated now, you'll be able to have a better and healthy oral health. So until I come your way next time, make sure you avoid using harmful objects in your mouth. Avoid using hard toothbrushes except if it's on prescription based on some peculiar reasons by your dental professional. Avoid brushing so hard. That's not a way of keeping your mouth clean. Avoid them. And please, when you notice any of these things, probably you notice blood coming out from your gum when you brush, seek expert attention. Don't self-medicate. The only thing you can do if you don't have access to a dental professional or a dental clinic at that moment, you can just do salt in warm water gargle, or just warm water alone. Just gargle 2-3 times in a day, pending when you have access to a dental professional. So until I come your way next time, keep healthy. Make sure your teeth are always healthy, because if you lose your adult tooth as an adult, it is gone forever. You won't get it back again. Any other thing you get back will be an artificial teeth. And of course, you can never compare natural teeth to artificial teeth. So we make every effort to make sure that you have the right information to keep your God-given teeth the way they are. So thank you so much. Until I come your way next time, stay well.